Good evening, greetings to all. Today we try to answer some questions about cochlear implants. Now the first question is, why cochlear implant is required for my child, and is there an alternate treatment option? Now cochlear implant is required for your child because he has severe to profound hearing loss. It is required mostly when the loss is in both the ears, and the normal amplifying devices like hearing aids do not help his hearing loss. If cochlear implant has been advised for your child, there is no alternative treatment option, because if you have profound sensorineural nerve loss, there is no way the nerve loss can come back. The second question is how cochlear implant works. Now cochlear implant is an electronic device which has improved and got sophisticated over the years. What it does is it changes sound energy into electrical energy and stimulates the nerve of hearing, which in turn the signals are sent to the brain and the patient is able to hear. Now if you see this, one of the modern cochlear implant systems, it shows there is an external part and there is an internal part. The first figure shows the external part, which consists of a microphone, speech processor and the stimulator. The second part consists of the electrode array and the receiver coil. Now how it works is, by a surgical operation, electrodes are inserted into the inner ear, either via a cochleostomy, that is insertion into cochlea, or via a round window, and once the wound heals, say after 10 to 14 days, the implant is switched on and the outer part, which consists of the speech processor, the stimulator and the microphone, that is also put on the patient and the implant is activated. The next question is, what is the difference between hearing aids and cochlear implants? Now hearing aids are amplifying devices. They only amplify the sound. There is no surgery involved, and they are helpful for mild to moderate or somewhat severe hearing loss, but they don't work in profound loss at all. Cochlear implants, in fact, they are put by a surgical operation where the electrode is inserted, and they are useful especially if patient has severe to profound loss in both the ears. In fact, before putting on the cochlear implants, always a trial of hearing aid is tried, and also a child, when he is waiting for his implant, is given initially hearing aid for a couple of months so that he gets accustomed to the sound which he is going to hear with the implant. Now if your child is only 11 months, can he be operated? Well, the earlier stage where we comfortably are able to put an implant is about 1 year, though people have done it slightly younger also. But the important thing is, child, the age of learning speech is up till 5 years, or at the most it can be stretched to 7 years. So if it has to be implanted, the earlier we implant, the better it is. Beyond 7 years, he will not be able to acquire speech. He may just have perception of sound, but he will not be able to acquire speech. The next question is, my child is 9 years. Will implant help in developing good speech? So as I said before, beyond 7 years, the chances of developing good speech are very minimal. So, normally we do not implant such children, but if the parents are all right with the child just hearing sound, say when he is walking on a road and he is able to hear the horn which is able to protect him, and they understand, then we can implant, otherwise we do not. Now, a very important part of cochlear implant is the post-implant training. The surgery is only one small part. After you do a switch on, say after 10 days to 2 weeks, then you need intensive AVT therapy. Here you need a trained therapist who is able to train the child in consultation and with the help of the parents. And this, if this is not done, the child will never acquire good speech. Now the next question is, will my child be able to live a normal life or will be able to join a normal school? Yes, a lot of these implanted children, once they start hearing and they have acquired speech, they will be able to join a normal school. In fact, our endeavor is to get more and more of these children into the normal school and the mainstream. Can you let us know more about the surgery? How safe is the procedure? Now, cochlear implant today has become a routine surgery. There are specialized surgeons who are doing cochlear implant surgery. It is a fairly safe procedure. The success rate of successful insertion of the electrode in the cochlea is more than 95%. There are few side effects. In a very minimal cases, there may be some issue with the facial nerve, but that is a very rare thing. And the surgery takes about 1.5 to 2 hours. It is done under general anesthesia. Your child will be able to eat, drink after 5 to 6 hours after surgery, and the normal stay in the hospital is about 2 nights, and bit of dressings and wound care is required for a week, and after about 10 days we are able to switch on the implant. Now you can see the surgery being done. It is a microscopic ear surgery, and you can also see the electrode as it has been inserted into the cochlea, and any surgeon who has a fair experience of the surgery is able to carry this out safely, and it is being done in a good number of centers. What is the life of the implant? Do we need to change the implant in future? Normally the implant is there for life. The companies give a warranty for the external part and the internal part separately. Normally there is no need to change the internal part including the electrode at all. Some problem is exception rather than the rule. The outer part, which consists of the speech processor, can be changed if somebody wants to upgrade in the speech processor. As the years pass, the technology improves. You have technologically superior speech processors coming. So if somebody wants to upgrade a speech processor, that can be done. Now again you see how the internal part looks like. You see the electrode and you see the receiver coil. How durable is the implant? Do we need to take the extra care of a child's head? It is a fairly durable implant. The fear of the parents that the child will break it or it will with mild falls or likewise does not normally happen, and the other fear is the child will not wear it, which is also not true, because as the child gets used to the implant, he likes to wear it because he is able to hear with the implant. So it is a fairly durable product. Except the early part of the post surgery time when you need to protect it from water, maybe for 2 weeks. After that there is no extra care required of the head. How different implant systems work and how are they different from each other? Now there are different implant systems by 4 or 5 international companies. Now, each implant system has its own features. These are all tested and meet international standards. Well, they differ in terms of the type of speech processor. The cost of the implant is also linked to the sophistication, the technological advancement of the speech processor. Also in the type of electrodes, whether it's a straight electrode or it's say contour advanced electrode. Then on the miniaturization of the external part, whether it's most of them are BTE, behind the ear, but there are newer ones which are coming up with a small button like thing like the Canso. Now some people don't like to have a huge big outer part, so they use this miniaturized part. The next question is, will my child start hearing and speaking soon after surgery? Well, as I said before, surgery is a small part. The implant is switched on and after that the training starts. And it's a slow process where slowly as the sound comes in, he learns to speak. The earlier we implant, the better it is, the better the speech acquisition is, and they start with monosyllables and then go on to sentences, and it takes some time for the speech to develop. So don't expect miracles, but cochlear implant has helped a lot of children, and if it is done at the right age and with correct auditory verbal therapy, the results are very good. Thank you.